Very happy today to be interviewing Dr. Patrick Quaid. He's a best-selling author, speaker, researcher, and optometrist. He's based in Guelph, Ontario at the View Cubed Vision Therapy Clinics. They also have a clinic in North York, Ontario as well. Welcome, Dr. Quaid.
Thanks for having me.
Dr. Quaid, a lot of people imagine that they could write a book. A lot of people plan to write a book. A lot of people dream of writing a book. You actually wrote one, and you've contributed to others as well, of course, and then your many academic papers and other things that you've created. What was it like for you to write a book?
It was harder than I thought. I think actually writing my PhD thesis was actually easier than doing the book, because you really had to learn a whole other language. You had to learn how to, what's that phrase? You have to speak into the listening of the person that you're trying to communicate with. And trying to take myself out of the doctor lingo was actually quite tough, because of course for years we're trained, for example, if you publish in a research journal or a medical textbook, every statement you make, you have to back up with a reference. You have to say, here's my statement, here's the research, here's the research, here's the research. Whereas this book was more about, okay, you are the expert, and it's up to you to communicate in a way that the patient understands, because the patient, not that they don't care about the research, but they care about what's going on with their child. So the doctor being able to explain that in a way that makes sense to the parent, well enough that actually the parent could explain it to another parent. So for example, often parents will come in for the consultation, and not always are both parents in the consultation room. There's one that comes with the child, and maybe the other parent is at work. And it's often hard for that parent to then go back and explain the concept to another parent. So that was actually part of the motivation as well behind the book, is taking that pressure off of that one parent to be able to explain it to another. Now, obviously, we've set up our intake in the clinic so that there's actually a specific communication step to make sure that we make it clear what the diagnosis is and how it pertains to the ability of that child to read and spell. But the challenge of the book, I think, was trying to really make a concerted effort to put myself in the position of the parent, which was actually kind of a humbling experience, because when I started doing that, I started thinking about what my mom went through as a kid, because she also had one eye that was down to about 20% eyesight, and the other one was down to probably 60%. So she struggled with poor vision her whole life. So trying to keep that framework in mind when I was writing the book, it was very different to what I was used to for my PhD and the research and everything like that. So actually, I enjoyed the experience, but I would say, as you said, we're going to write the book. We'll keep the flowers, but we'll just get rid of the weeds, right? So I think it really was an enjoyable process, and it actually helps your communication skills as a doctor, because you're forced to get outside of your lingo. So I enjoyed the process. It was a challenge, but I certainly enjoyed it.
We were speaking to Dr. Patrick Quaid. He is the founder and CEO of the View Cubed Vision Therapy Clinics in Guelph and North York, Ontario. The book is available on Kindle, Amazon, and also on Audible. So if you haven't got a copy yet or heard a copy, you can get them there. Thanks so much for your interview today, Dr. Quaid.
Thanks for having me.